Hi, doctor. How are you?
Hi, I'm very good.
Yeah. So I wanted to discuss my girl. We spoke on the phone yesterday. Yeah. So she's just 5 months old, and she has this big swelling in her umbilical region. See, this is how it
Right.
looks. Yeah. Yes, so we were told that there's an umbilical hernia. So we consulted a lot of surgeons. Some said we should immediately get operated. Some said we can wait. Doctor, I need your opinion. Uh, what can we do? Should we operate? Should we wait? What can be the risk?
So,
Please.
umbilical hernia happens because of a defect it's a muscle and a sheath defect in the umbilical region. It can be through the umbilicus or supraumbilical or infraumbilical, right? Now, depending upon what is the size of this defect, is the further treatment decided. Like if the defect is very, very small, something like a 5 mm defect, and there is nothing much which is herniating, so there's no bowel or omentum, just a preperitoneal fat or something, then we usually wait. So we wait till at least a year age, because it's seen that most of the times by the time the child is 1 year old, it just closes on its own. Alright, now coming to a big defect size, which looks like in your child because the hernia is fairly big. Yeah, so if the defect is big, then again it is not a very worrisome or an urgent situation, because although the defect is big, the contents which are herniating, whether it's the intestine or the omentum, yeah, it goes back in also. Like when your child will cry, it's going to herniate. When the child is at rest or sleeping, then the contents go back, right? Okay, so then in such cases again we have to be watchful for the warning signs, and we can keep on a close follow-up, right, till 1 year of age. Now at 1 year of age, then we have to decide further whether the hernia is closed or not, whether it's open, are there some adhesions, how much of how wide is it, what is prolapsing into it. Now coming to the size, when the size of the ring is intermediate, and so the size is not very big, yet the intestine and the omentum is herniating through it. This can be a little scary situation where we need to be more watchful, because here the intestines can herniate, and then because of the gas collecting and the oxygenated blood is still going, but the deoxygenated blood or the venous blood is not being drained, so there can be edema or swelling of the bowel, and then the bowel will not go inside, and a situation of like an intestinal obstruction can develop in these babies. So these babies, we can need surgery, that's possible, but again we can observe till 1 year of age, of course being
Yes,
watchful
doctor.
of
Got
the
it.
warning signs.
You said warning signs. Can you just please tell me what are these warning signs I'm supposed to look for, and when do I come to you? Like, how do I find out that now it's time to come to you?
Right. So these warning signs are if there is any swelling in the umbilical region, that's the hernia, and it does not reduce or flatten even at rest when the child is sleeping. So if it's persistently there, if there is redness in that area, if there's any discharge coming out of that area, if the child is vomiting, if there is distension, the child is bloated, the child is not being able to pass either stools, and more importantly not even passing flatus, and if any of these signs are there, then you need to approach the doctor at the earliest, and then maybe the child will need the surgery immediately. Yeah, so these are the signs of obstruction you need to look out for.
Thank you, doctor. Fine, we'll be watchful for the warning signs. But what is after 1 year? How are we going to go about it?
After 1 year, actually first you need to physically bring the child to me. I have to examine the baby before we decide the further plan. Until unless I know how is big is the defect, what are the contents, how is the baby, I won't be able to promise you that this is the line of treatment at present, right? That's just waiting. Another thing is I also need to examine the baby to see, because sometimes these hernias are associated with hernias at other sites, like an inguinal hernia or so. So that's why, yes, a physical examination is must before we decide that. But yeah, if we are thinking of a wide defect and we are waiting for a year, so then after a year it is less likely that it will close on its own. Then it does require a surgery.
Doctor, I saw your video on inguinal hernia in boys and girls. So, like in them, you do a daycare surgery. Will this also be a daycare surgery, like one day we come in the morning and get discharged in the evening? Also, like in inguinal hernias, you don't need mesh. Do we need a mesh here?
As you asked, yes, it can be done in a daycare setup. Yes, so morning you will walk in, the surgery will be done. By afternoon, evening, we start the feeds, and once the child tolerates the feed, we can discharge the baby. And like inguinal hernia, most of the times these babies don't need a mesh, and yes, the sutures that we take are absorbable and they are stronger ones. They don't need an additional support here. This is mainly a muscle defect rather than a weakness. So we don't need to strengthen it with a mesh. We need to close the defect.
One last question, doctor. My wife is very worried about, how will it look cosmetically? Like, will the umbilicus be disfigured and, how will it be seen?
Okay. So, most of the times, this umbilical hernia is limited to the umbilical region or it is supraumbilical. Both the cases, the incision or the cut that we're talking about is taken within the crease of umbilicus. So the scar is hidden within the umbilicus and it's not seen outside. So it's cosmetically excellent. Now, in hernias where they are very large and there's a lot of loose skin, we do something known as umbilicoplasty. We have to excise part of the skin and again form a good normal looking umbilicus. Even in that case, the scar is almost hidden within the crease of umbilicus. So cosmetically, there's nothing to worry.
Thank you so much, doctor, for your time. This was very helpful. And once we are in Mumbai, I definitely want to come for a physical consult at the earliest to show my child. Thank you so much.
Thank you.